All right, so we'll go ahead and get started. Welcome to our Family Connection Workshop on anxiety and depression. My name is Deja, and I am a family outreach representative with our Office of Family and Community Engagement here with VB Schools. Tonight, I'll be hosting our first hybrid workshop where we'll be learning how all of you can help understand and recognize signs and symptoms of anxiety and depression in your students, and to help with that. I'd like to take this opportunity to introduce our two panelists from CHKD. Today, you'll hear from Ms. Amanda Bartolome, a mental health therapist and resident in counseling, and Ms. Rebecca Dehoff, a licensed master social worker and mental health therapist. Ms. Bartolome is a mental health therapist in the Virginia Beach CHKD Bridge program and has been at CHKD for the last year. She has her bachelor's degree in cognitive neuroscience and psychology and her master's degree in clinical mental health counseling, and has also worked as part of CHKD's intensive outpatient program. Our second speaker, Ms. Dehoff, holds her bachelor's degree in psychology as well as her master's in social work, and is a mental health therapist in the Virginia Beach CHKD Bridge program as well. Having been at CHKD for about a year, she has worked as part of their crisis clinic and also provides coverage in their emergency department, supporting their mental health team. And last but certainly not least, we'd like to thank Ms. Mary Hunt over here. She is our Family and Community Engagement Administrative Office Associate and has helped put all of this together for you all. We're very excited to have you here. We're very excited to hear this information, which is exceedingly timely, and we hope you enjoy this and we get a lot of good feedback from you all on what else we can provide for you and your families. Amanda, I'll turn it over to you guys.
Are we just searching? The notes and PowerPoint?
Oh, let me get that.
Okay. All right, while we're getting that pulled up, thank you for that introduction. Again, I'm Amanda Bartolome. I am one of the mental health therapists working in the Virginia Beach City Public Schools CHKD Bridge program. We also have Ms. Stephanie also with us today, who's our Director of Mental Health, who's going to be helping us towards the end with some questions. All right, everybody, sorry about that. All right. So today we're going to be talking about a couple of different things. First, we just want you guys to kind of understand the importance of youth mental health and talk about how anxiety and depression affect our youth, and be able to identify signs and symptoms. We also want you guys to be able to learn about ways to approach mental health, both at home and for those of you who are school staff at school. We're going to start with going over what the Virginia Beach City Public Schools CHKD Partnership Program is, and then towards the end, we're going to talk about ways to refer into that program. So again, I want to start today by first going over what this program is and the purpose of the partnership program. So this program was developed and launched earlier this school year. It's a way to provide safe and effective mental health treatment to middle and high school students. So again, we're very aware that the mental health crisis in this country it is important, and the fact that wait lists for mental health services can be extensive. And so this program was developed to kind of help bridge that gap in care until we can get connected to longer term services. So right now, Rebecca and I are the two mental health therapists working in this program. We're providing short-term services, about 4 to 6 weeks or 4 to 6 sessions, to students who are displaying these high-risk behavioral or mental health concerns. The school is covering the cost of this service, so no insurance is necessary. At intake, any recommended services, so therapy, psychiatry, psychological testing, if we recommend it, we'll provide those referrals in the community for you guys. Again, the goal is to get you guys connected to longer term services in the community, so this is a short-term program. And then in an attempt to help spread mental health awareness and education, the school also has brought Rebecca and I on to provide some trainings to teachers and staff. So kind of like what we're doing tonight, we've also been doing with some of the teachers and staff within Virginia Beach City Public Schools. On Monday, we completed a training with the staff on youth suicide, and last week we had done one on anxiety and depression similar to this one. So before we get into the anxiety and depression in youth sections, we want to start by talking about why youth mental health is so important. So approximately 1 in 5 children in the US meet criteria for a mental health disorder. This number doesn't include those who experience symptoms of mental health disorders and not quite meet the full criteria. And so the number of children this affects is probably much higher. And so this is just not a small problem or one that's kind of rare to youth, which is why it's really important for us to have these conversations and have these trainings and offer these services. And when we're looking at the onset of mental health disorders, we see that the average onset of anxiety disorders is around 6 years old, ADHD and some other behavioral disorders around 11, and then mood disorders around age 13. We also know that about 75% of adults who are diagnosed with a mental health disorder display or experience symptoms before they turn 21. And that, again, is why early intervention is key and why services such as this one are really, really important. We also put this at the end, just again, because it's so important and so prevalent. Suicide is the second leading cause of death for youth ages 10 to 17. And so that really puts into perspective how intense and this mental health crisis the US is facing is. There are also some trends in the statistics pertaining to youth mental health. For example, we know and we see that females present at a much higher risk of anxiety and depression compared to their male peers. However, this could also be due to underreporting due to the stigma related to mental health in males. So in the chart to the left, you guys can see that the percentage of high school students who reported poor mental health in 2021 was about 29%. So 29% of high school students who were surveyed reported that during the year 2021, they experienced poor mental health. 41% of those being female and 52% identifying as part of the LGBTQ+ community. Those who are multiracial, have a history of trauma or neglect, or live at or below the federal poverty line are also at a higher risk of experiencing mental health disorders. And the chart on the right displays the rates of disorders by age. And so we can see that depression and anxiety are shown at the highest rates from ages 12 to 17, while other behavioral disorders are shown at the highest around 6 to 11 years old. Again, we can't stress enough how important this early intervention is and making sure that we can provide appropriate resources when we can. So we're going to move into youth anxiety. So what is anxiety, right? Anxiety is that intense and persistent fear or worry about everyday situations. There are a lot of symptoms of anxiety, which we'll go over in another slide. However, it's important to recognize that not everyone who experiences anxiety meets the criteria for an anxiety disorder. What we're looking for in diagnosable anxiety are symptoms that cause significant distress and interfere with multiple aspects of daily living. And so a lot of times when I work with kids, I often use this metaphor of a fire alarm when I'm explaining anxiety. And so anxiety acts like our body's alarm system. It works to alert us when something dangerous could be happening or something that we should be aware of. And so, for example, a smoke detector or a fire alarm goes off when there's a fire to alert us to say hey, something's happening, we have to seek safety. This would be, in this case, a true alarm because that external threat is present. And in this case, that worry is appropriate and help kind of keep us safe. But sometimes that alarm goes off randomly and for what we feel like is no reason. Like if I burn popcorn in the microwave, or if I burn something, or if the batteries need to be replaced. And in these cases, there's no real threat present, but that alarm goes off anyways. And this is what that false alarm is. And when this happens, we need to kind of use our interventions and strategies and reframing to kind of recognize, hey, this feeling is a false alarm. What can I do to help myself cope with this feeling? There are a lot of different types of anxiety. Today, we're going to focus on the 4 that you guys see here on the screen, just because these are the ones that we see most frequently in children and adolescents. And so that first and most common one is that generalized anxiety disorder. So this is that chronic and persistent anxiety and worry in everyday situations when there really is little to no threat present. The next we're moving into is panic disorder. So this is that intense or elevated fear that's associated with these physical symptoms like chest pains, heart palpitation, shortness of breath, dizziness. The symptoms vary from person to person. So just because a person doesn't look like kind of what we anticipate them looking like when they have a panic attack, kind of like what's shown on TV and in movies where they're kind of hyperventilating, doesn't mean that that's not what they're experiencing. We're also going to look at some social anxiety. So that's that anxiety that is that worry or overwhelming fear in everyday social situations, such as like at school, in sports, around other teens or youth, even around adults in that case. And those who experience social anxiety often report feeling self-conscious or preoccupied during these social interactions. and may engage in some avoidance behaviors due to their anxiety. So children who don't want to attend a birthday party, don't want to attend school, are often experiencing this social anxiety. The last one that's on here today is one that people are really surprised sometimes that we categorize under an anxiety disorder, and that's post-traumatic stress disorder. So PTSD is anxiety and fear developed after an exposure to an event in which like either real or perceived physical harm or danger occurred or was threatened. Again, there are other types of anxiety. There are specific phobias like fear of needles or heights and things like that. And again, obsessive compulsive disorder. But again, today we're going to be just kind of focusing on these four because this is what we're seeing most frequently in the clinic. So on the screen right now, we have these signs and symptoms of anxiety, but it's also important to recognize that not every child is going to present with anxiety in the same way. Kind of like I talked about in that last slide, it might vary person to person. Some might appear more avoidant or hypervigilant, and others might appear more angry or irritable. And so it's important to just be aware of this when determining what's going on, just because interventions and treatment can vary based on that. And sometimes symptoms for one mental health disorder often overlap with another. And we see that a lot with like anxiety and ADHD. And so just being mindful of that. And if we feel like we need help differentiating between the two, making sure we're following through and kind of looking for those extra resources or assistance to kind of help doing that. So despite the fact that it varies person to person, there are frequent symptoms we see in those who experience anxiety, such as those that are kind of listed on that screen. That would be the excessive worry, fidgeting, racing or ruminating thoughts, so having trouble like sleeping because we're having these recurring thoughts that are causing us anxiety. Avoidance behaviors, again, not wanting to go to school, not wanting to do certain things because of our anxiety. Or these psychosomatic symptoms like the stomach distress or stomach upset or headaches. So again, not an all-encompassing list, but these are definitely the ones that we see most frequently in the clinic. And if we notice that our child or we notice that our student is exhibiting some of these symptoms, we just want to make sure that we're intervening and providing appropriate help. So there are many different sources of stress and anxiety in children and youth. We're going to first look at these daily stressors, and those are those short-term stressors that most kids will experience that can create that positive stress response. So these can be things like tests, presentation, brief conflict with friends, transitioning schools, so moving from like middle to high school or elementary to middle school, or acute illness, so getting the cold, getting the flu, things like that. Experiencing some of these daily stressors can help teach us distress tolerance, or that ability to tolerate stressful everyday situations. What we want to be aware of more so are these chronic stressors, which can lead to anxiety or depression or other mental health disorders if left untreated. So these chronic stressors would include things like ongoing family conflict or instability, persistent health problems, either of themselves or of someone they love, like a parent or a guardian. Any kind of abuse or neglect or trauma, as well as like financial distress or poverty, a lack of overall safety, either within the home, within the school, within the neighborhood, as well as bullying. Bullying is a huge chronic stressor for kids. Rebecca and I had discussed it yesterday. A lot of the kids who we see in the clinic report experiencing bullying and are experiencing these long-term effects that kind of result as you know, that occurs. So how can we help if we notice that a child is experiencing anxiety? So first, we want to kind of improve and expand their emotional vocabulary. So we want to first help the child name and identify the feeling that they're having. In this case, an emotions chart or an emotions wheel is really helpful, because a lot of times kids will come into the clinic and they'll say like, I'm feeling angry, or I'm feeling bad or sad. They'll use these really like basic and vague terms. But after we talk to them, we kind of recognize that maybe they're not feeling angry or bad. Maybe they're feeling more anxious or overwhelmed or overstimulated. And so by being able to recognize and specify which emotions we're having, it's easier for us to intervene and cope with those emotions. We also want to start looking for any warning signs that our child may become anxious. So the more that we kind of pay attention and stay in tune with that, we'll begin to see some patterns in what happens leading up to them experiencing anxiety or panic. So this could be things like fidgeting, maybe they're getting really hot, maybe they're talking a lot, maybe they're not talking at all, and they're isolating. So just making sure that we're able to recognize the warning signs in ourselves and also in our children, just to kind of implement those coping skills and prevent any escalation of symptoms. Of course, we're also going to validate any feelings the child expresses, not placing any kind of label of good or bad on the emotions, and avoiding that shame and blame for having that emotion that they're talking with you about. We'll talk about this a lot more in depth in some later slides. We also want to be aware of the energy and body language that we're giving off. One thing I see a lot with parents who come into the clinic is that when their child becomes distressed, they become distressed. And so a lot of times in the situation, I'll tell parents, like, in these situations, we need to share our piece and not kind of join their chaos. And so making sure that we're teaching skills and we're teaching strategies, and we're also using them ourselves, so that we can cope and we can kind of model that appropriate expression of emotions. These can be things like some deep breathing, some mindfulness activities. There are lots of great YouTube resources that have brief mindfulness. Calm, I know, is an app that a lot of students use. Calm also has a free channel on YouTube that has resources that you guys can take a look at. We're also going to be using some strength-based language and support the use of that positive self-talk. We provided a handout in the back for you guys that has some specific exercises and examples on it that you guys can try at home. So when we notice a child is having or expressing anxious thoughts, we want to help them by challenging and reframing or changing what these thoughts are. And we can do this by asking some of the questions that are up on the screen here. We can ask, like, how do I know that this thought is true? What's the evidence to support that this thought is true? Is it helpful to me in this moment? Is it true, right? Is there another way for me to look at this situation? And so once we can begin to recognize when their thoughts are kind of distorted or causing anxiety, we can work on reframing it into a thought that's maybe more true or more helpful to that situation. So those who experience anxiety are also kind of feeling that lack of control. They're trying to gain control over things that they likely can't. And so by offering choices, by promoting problem solving, we can kind of help them gain that sense of control and ease some of their anxiety. When anxiety-provoking situations can be anticipated, we want to promote that coping ahead skill. So being able to create a coping plan or a plan of action to avoid the anxiety escalating. So if we know that your child gets really anxious or upset before like a big game or a presentation, we can sit down with our child and say, like, okay, this day we know that this is coming. How can we prepare and how can we cope ahead? That day, if we begin to feel anxious, what are some skills we can do? Let's create like a step-by-step plan so that we can have these skills in place and make sure that we're using our appropriate interventions. And of course, we always want to be able to praise and reward our child for any effort they make to manage their worries or express their emotions, even if in that moment they're unsuccessful in doing it. So making sure that we're really praising so that our child feels open to talking to us, makes them feel open to discussing some of these more touchy or sensitive subjects. So I'm going to close out the anxiety segment by looking at ways that we can respond to someone who may be experiencing anxiety. So like I mentioned, a couple of times before, we really want to avoid these invalidating responses and that shame and blame when we respond to our child. These type of responses can sound like, what do you have to be anxious about? Or just relax, or just get over it, or just breathe, right? These will make the child or youth feel like their feelings aren't valid, and likely cause them to kind of clam up and not want to talk about their mental health or some of their feelings in the future. So instead, we want to use this really supportive and open language, kind of like those displayed on the screen. So like, it sounds like this has been really difficult for you. Thank you for sharing this with me. I really appreciate you sharing with me. How can I best support you? So these responses are promoting that emotional expression and promoting that safe environment for our child to be able to come and talk with us, and just promoting healthy communication in general. And so how we respond to our youth who's experiencing anxiety is really key to make sure that they come to us when they need help and they come to us when things are going on. I am going to turn it over to Rebecca now, who's going to be going over youth depression.
All right, so for the second part of this, we're going to focus on youth depression. So we have some kind of statistics, facts on youth depression. So as you can see kind of here on the screen, In 2021, there was approximately 42% of high school students that reported they experienced persistent feelings of sadness or hopelessness in the past year. Of those 42%, 57% of those were female and 29% were male. So kind of the same way with the statistics for the anxiety, we're seeing a higher presence in females. Also, from 2011 until 2021, the same study was completed, and the increase in 2011 went from 36% to 57% in females and 21 to 29% in females. So over the past year in the US, there was a reported 16.39% of youth that were aged 12 to 17 with at least one major depressive disorder. And in the state of Virginia, the prevalence of youth with major depressive disorder is 19.56%, or around 124,000 youth aged 12 to 17. So kind of depression, and what is depression? So depression, it's characterized by persistent feelings of sadness, lack of interest or pleasure in doing activities that were once rewardable or enjoyable. So depression can affect a person the way they think, the way they feel, they behave, and can lead to emotional and physical problems. Typically, depression will lead to some type of impairment in their daily functioning. So there may be some disturbances with their sleep, their appetite, concentration in school. They may seem more tired or fatigued when they're at home. And this type of impairment can become very distressing to the individual. So at times we kind of wonder, how do we know, is this just our teen going through some mood changes, or are they possibly experiencing some symptoms of depression? So a couple of things to consider. So one of the symptoms, as we mentioned, was being really tired or fatigued. It's just really kind of asking a few questions. So what is it that my child is doing right now? Do they not have, a lot of downtime? Are they very busy with extracurricular activities, their homework? Are they involved in a lot of things where they may just be tired from these events, or are they not sleeping? So really understanding why those changes are occurring and the reason behind them. And as far as kind of isolating that can happen with depression, really focusing on those same things. So we've noticed that our child is starting to isolate in their room, but we also know that as teens get older, that they do want more privacy. They do like to spend a lot more time in their room, but also paying attention to the things that are going along with that. So are they spending less time, downstairs with family as far as talking, interacting? Have you noticed the same thing happening and occurring with friends? So are they starting to turn down options to go out with friends? You notice that maybe they're not communicating with their friends anymore. Could be a time to maybe, have a conversation with the child. And if you're noticing a loss of interest, so they're no longer interested in some of the things that they once enjoyed, have they started replacing them with new interests, or have they just lost all interest completely and haven't started picking up new interests? So just a couple of things to think about when we're looking at depression, how it presents, and kind of just the teen and the overall child. So kind of looking at the everyday versus overwhelmed feelings. So everyday feelings are the things that that kind of come and go throughout our day. So we may be in school and there may be a situation where we didn't do so great on the test, but now we're feeling angry, we're feeling sad, whatever feeling or emotion might be linked to that. But it's something that kind of changes and comes and goes. Also, it may be, they're angry because of a situation that occurred between them and a friend. They come home, they talk about it, feelings haven't stayed around all day, it's kind of coming and going. Those overwhelming feelings are those type of feelings that come and they stay for a long period of time. So you're looking past 2 to 3 weeks of that same feeling, same behavior, and it's kind of interfering with what they really want to do in their life. And there's some of the signs and symptoms of depression. So as Amanda was saying earlier, every child, of course, presents different with their signs and symptoms of depression. So, you know, we have someone here, the feeling sad, feelings of hopelessness, worthlessness. You may see a change in their self-esteem. The sleep habits, they may not be sleeping, they may be sleeping a lot. Concentration, maybe the focus at school is just not what's kind of a norm for them, or the isolations from others, the poor hygiene. So maybe they at once were taking 2 showers a day. Now you can only get them to shower twice a week. So some concerning things that could pop up. So if you notice any of these signs and symptoms, it's really great to kind of check in and have that conversation with them just to see how they feel they are able to manage these things that they're feeling. So kind of asking the question of, how do you feel? Are you able to manage this? Or do you feel like these feelings are so overwhelming that you're unsure if you're going to be able to handle these without some additional support? And this slide focuses on 7 of the most common causes of depression. So one of those is kind of our brain chemistry. In our brain, we have some neurotransmitters, which is a naturally occurring brain chemical that kind of carries signals from parts of our brain and body. So when these chemicals are abnormal or impaired, the function of the nerve receptors and nerve systems change, which can lead to depression. When those chemicals are imbalanced is where we see that. There's also traumatic events that could happen during childhood, such as any type of physical or emotional abuse, traumatic events that they may experience throughout their life. All those things can kind of cause the changes in the brain that do increase the risk of depression. Drug use, poor diet, physical health, and stress are some other common things that we see related to depression. So helping someone with depression. So it kind of falls in along with what Amanda was saying as well, of like some of the words and phrases we say. So when we're helping someone with depression, it's important to use that relaxed, non-threatening body language, and to just be mindful of our facial expressions and our emotions when we're talking to our child. So when they do get to the point where they feel comfortable sharing their feelings and thoughts, we don't want to turn it into an argument, get angry by the things that they may be telling us, or downplay the things that they're reporting. Just be mindful that those are their feelings, and kind of respecting what they're sharing during that time. It's also important not to put any blame on them for the things they share or make them feel guilty during that time. It's important to validate their feelings and actively listen to the things they are sharing. So some of those reassurance and support, kind of, thank you so much for telling me. I'm here to listen and help you however I can. Offer any of the support options that you feel might be available to your child, and have that conversation with them as well. All right, so some of the other ways of supporting others, of course, the one is knowing the signs and symptoms and when we want to step in and provide that additional support. Offering that safe place for the child to talk, where they're feeling like they can be heard, validated, and acknowledged during their conversations. During those times where you may notice that they're not wanting to participate in those activities, still encouraging and offering those options for them. It could be even something, you don't want to go to practice today. Well, how about we go outside and we participate in that activity together? Just something to try to work on decreasing that isolation. And then continuing to try to encourage that connection within the home. So maybe offering a family movie night, any type of things that you enjoy doing as a family, trying to offer those during those times where you're noticing some of those changes with emotions. You can also offer some different healthy coping strategies, some like journaling, deep breathing or relaxation techniques, engaging in some type of self-care. So something that really makes the child happy or feel better. And then when we are creating this safe space to share, it's important to kind of utilize those active listening skills, which we've been talking about throughout the presentation. So making sure we're paying attention, not interrupting during that conversation, maintaining the good eye contact, maintaining our positive body language, listening non-judgmentally, and just listening and being empathetic to the things that they're sharing. When that time does come, we want to make sure that we are providing that uninterrupted time. So we put our phones away, we might turn the TVs off, we're giving them the entire focus. And then of course, validating, accepting their feelings, and continuing to promote that time spent as a family. And then our last slide is kind of about referring to our Virginia Beach clinic. So all of those referrals do go through Virginia Beach Public Schools. It's all done through school counselors, school social workers. And when those referrals are sent to us, the criteria for the clinic includes any of the middle and high school students who have experienced a recent trauma, have experienced loss or emotional stress that's impacting their functioning in the classroom, are expressing any risk behaviors such as self-harm, suicidal ideation, substance use, or experiencing a life stressor or changes within the home that impact their functioning in school. With this program, it's also, because it is a short-term program, so they're seeing us for 4 to 6 sessions, they're already not connected to a provider because we would not be taking over that long-term care. So if they're set up with somebody for long-term services, that's the best option for them. And then, of course, if there's ever a time where you're concerned about the safety of your child, maybe you're waiting to be seen by a clinician or getting in for appointments, there's always the crisis text line, which is 988, so you can call or text that. And then, of course, your emergency departments if you are feeling a concern for safety.
Thank you so much. So we have a list of some of the questions that have been submitted so far. So I'll ask, they'll answer. We've got about another 15 minutes, so we'll see how many we can get through. All right, so the first one we got is, what is being done to educate VBCPS staff on mental health concerns and responses?
So this was a big piece of the program that was developed for Virginia Beach City Public Schools, was educating teachers and school staff on signs of and symptoms of depression, anxiety, suicide risk, as well as just mental health first aid. How do you respond in these situations more effectively? As teachers and educators, there's not a lot of mental health training that goes with that. And today, our youth are experiencing a significant mental health crisis. In fact, in 2021, the Surgeon General of the United States declared a state of emergency essentially around children's mental health because of how prevalent it is. And our governing bodies, our Children's Hospital Association, American Academy of Child and Adolescent Psychiatry, jumped on board and said, we are really facing a crisis. So the reality is we had a crisis before the pandemic, and the pandemic just simply exacerbated that crisis. But we're working really hard with our school staff to be able to provide as much education and support around mental health and how do you respond to your students when they're struggling and how to recognize when they're struggling and make sure that they're making contact with the family to provide support and resources.
Thank you. The next one we have is, should parents communicate mental health concerns to teachers and school counselors?
So absolutely. I think it's really, really pivotal for children to have teachers and counselors that are aware of the challenges that they're facing. And this is something that, our kids spend 8 hours a day in school. And if they're facing something pretty significant and no one at the school knows about that or knows what they're facing, then it's really difficult for anyone to provide that level of support or scaffolding that they may need. So it's very important, I think, to be as open as possible and communicative as possible with your child's school about what they may be facing. Is there anything? Keep going. Okay.
What should parents do if a crisis arises when a child is waiting for services?
So that's a great question. Being fully transparent, there are not enough providers in our region to provide the care that's needed for all the children who actually need care right now. At CHKD, our outpatient program, we're on target to do about 60,000 outpatient visits this year. And unfortunately, that is not enough. We have about 4,000 kids, and I said that right, 4,000 waiting for care right now. So it is a real crisis. There are community providers, they're also full. It's difficult to get your child into care. One of the things that we've done at CHKD is created a public health approach with our outpatient program. So when a child's referred to our program, they get in relatively quickly to get a brief clinical needs assessment. And that assessment helps us determine what they need. So do they need services right away? Do they need services imminently, or can they wait a little bit with some support in place? And so the support in place that we're offering is group-based therapy. And about 80% of the kids that we evaluate can benefit from skills-based groups. Some of those kids won't actually need care beyond that because they just needed tools for their toolbox in order to be able to be more effective in how they navigate and manage situations. So unfortunately, a lot of parents decline that group therapy. And it really blows my mind because it is a great resource. We're finding considerable impact from these groups. In fact, about 90% of those surveyed after participating in the groups said that the groups were helpful and useful for their child. So we're really seeing a lot of good progress with those. And if you're in a situation where you might be on our wait list, your child's on our wait list, and you did not take advantage of group therapy as the first option, go back and call us and let us know. We can get you in a group and get that child started with some treatment. Because we know that definitive care, the individual therapy, the psychiatry, the psychological testing, there is a wait for those levels of care. If your child is in crisis, if you are concerned about your child's safety, if you want a mental health professional to evaluate your child during that period of time that you're waiting, our emergency department has 24 hours a day, 7 days a week, mental health professionals who are providing evaluations. It is our access center. So it is the center where kids go if they need inpatient care, inpatient treatment, acute treatment. We have several levels of care. And so if a child is in crisis and comes to our emergency room and they need an acute level of care or an imminent level of care, then we can help connect them to that from the emergency room. You can go to the closest emergency room to your home as well. It's not just us that has services. However, ours are tailored specifically for children.
When should parents seek professional help for mental health concerns?
So what the presentation showed you today were signs and symptoms, things to look out for. And it really is about the impact on their daily functioning. So what's happening day to day for them. If you see your child and they are not the same kid that you saw 6 months ago or 3 months ago, or 2 weeks ago or 3 weeks ago, and you're really worried about them, you need professional help. So the reality is that if it's something that comes and goes, is short term, maybe they're moody sometimes, that may just be who they are, that may be their temperament. However, when it starts to impact their grades, their friendships, the things that they once liked to do, their sleep, their appetite, that's when it's really time to reach out and get some professional help with that, just as you would if your child had low blood sugar or high blood sugar and you felt like maybe they had diabetes. You're going to want to find that out. So that's really the time, the barometer with which you want to reach out for help.
So you answered really, really good advice on other things you can seek out if you're in crisis. So back to groups, what group therapy options are there actually? And will the school offer anything like that to help in the future?
So I'm really excited to say that we are in talks with the school right now to expand our team and get some folks out to the schools to provide some of these skills-based group for kids in schools, which I think is a really great opportunity. As I mentioned at CHKD, that is the first step in our stepped care programming, our groups. And we offer several different layers of groups. We offer early childhood groups, really more parent management. And then we also offer parent management for teens, so kids like 10 to 13 years old that are having difficulty managing behavior. Parents are having difficulty managing them. So a lot of that work is done with the parents to help give them tips and understanding as to how to manage that behavior. For kids, we have cognitive behavioral therapy groups that are really good for kids with anxiety and depression that teach those cognitive behavioral therapy skills. How do our thoughts, our feelings, and our emotions all play together? And then also we have dialectical behavioral therapy groups as well, which teach skills in managing distress, so distress tolerance, emotion regulation, mindfulness, and also interpersonal effectiveness. And those are things that, unfortunately, sometimes our kids aren't learning today the way that we did when we were growing up, when we had to, you just kind of look to the phone there. It's a blessing and a curse, right? It's not all bad, it's not all good. And we know that it does have an impact. And so when I think about what we did as kids, and I'm older than many people in this room, but what I did as a kid, if I had a report that I had to write, I had to go to the public library and get the microfiche and really work to find out what I needed for this information for this report. The Encyclopedia Britannica, right? Everybody had a set in their house, or somebody had a set in their house. I had to go find out who had that and could I use it, right, to find the information. So we were always seeking. We were always working to get something done. And that really taught us how to manage that distress and how to manage some of the things that today are at our kids' fingertips. Every single minute, every single thing that they do sometimes is highlighted on their social media threads, right? And I'm the parent of a 14 and a 15-year-old. So I am very cognizant of how important some of that stuff is for our kids. And also very cognizant of the fact that sometimes we have to take a break, we have to step away from it. But management of that stuff, I could go down a rabbit hole there, so I'm not going to do that. But there definitely is an impact.
Awesome. We'll ask you one more. Is telehealth as effective as in-person therapy?
So it is, and research has shown us that telehealth is as effective as in-person therapy. Now, there are some kids that I would want to see in person, and there are some situations clinically that I might say, I need them to come in. I want to see them in the office. But for the most part, especially with depression, anxiety, some of our single system mental health disorders, ADHD, telehealth therapy is actually really effective and can be very powerful for kids. They've spent a lot of time on screens over the last few years, as we know, with school and with other things, and they're comfortable. comfortable with it now. And so I think that it absolutely is as effective. We do right now about 60% telehealth, 40% in person. So, you know, it's happening. We've been doing it for quite some time, and it is equally as effective.
Do you guys have anything you want to add?
No, I think that it just got over it.
All right, I'll close this out.
All right, great.
Awesome. Well, thank you guys so much for coming. We are at the end of this workshop. Our panelists, we just want to say thank you for your time. Thank you for your dedication and your insight in helping our community. If you all, any of our families here in person or online, if you have any other questions or suggestions for different family connections in the future, please scan that QR code. Let us know what questions you have and the sort of things that you would like help and resources on. We really want to hear that. Again, this workshop was recorded, so you'll be able to find it at vbschools.com if you want to see it again or share it with any of your students or other families that you have. Thank you all for being here. We hope you have a good night. There are resources back there for you, and we will have them available online or sent via email to those whose email address we have. So grab those on your way out. Thank you for coming, and good night.